Mr. President, today, more than 47 million Americans rely on Medicare for their health care. For more than 45 years, seniors have had access to the affordable, dependable health care that Medicare provides. We all recognize the cost of health care. We know it's growing, and growing too rapidly. The landmark health reform law that we passed recently took bold steps to rein in costs. And I'm eager to work with my colleagues from both sides of the aisle to further reduce health care costs, increase efficiency, and root out fraud and waste. Last week, the chairman of the House Budget Committee, Congressman Paul Ryan, proposed a plan that would end Medicare as we know it. Rather than providing affordable health care paid for by Medicare, as is the case today, under the Ryan plan, seniors would receive a voucher to purchase private health insurance, not to get health care benefits provided for under Medicare, but rather receive a voucher to purchase private health insurance from private health insurance companies. Unfortunately, this voucher would fall far short of covering health care costs for seniors. According to the Independent Congressional Budget Office, under the Ryan plan, quote, most elderly people would pay more, I might add much more, for their health care than they would pay under the current Medicare system. How much more? CBO says that under the Ryan plan, the average 65-year-old would have to pay $12,000 a year to receive the same level of benefits Medicare offers today. $12,000 a year. That is more than double what a senior would have to pay under today's Medicare. So the Ryan plan would double payments seniors have to make, and the benefits would be reduced. Under the Ryan plan, there would be no guaranteed benefits that are protected under Medicare today. And as a result, private insurance companies would dictate what care a senior received, ending the current doctor-patient relationship. Our deficit, of course, is serious. It's very serious. Must be addressed. While we need to look for more ways to reduce our deficit, we need to do so in a balanced and fair way. For starters, we shouldn't balance the budget on the backs of seniors. We will not allow Medicare to be dismantled, not on our watch. Yesterday, Senator Bill Nelson and I introduced a sense of the Senate resolution stating that, quote, Medicare should not be dismantled and turned into a voucher or premium support program, end quote. Deficit reduction should not simply shift costs to seniors. And that is exactly what the vouchers in the Ryan budget would do. A voucher system does nothing to lower health care costs. It does not guarantee the benefits Medicare offers today, and it does not provide access to affordable health care. Seniors deserve much better. Mr. President, I listened closely to my colleague from Louisiana a few minutes ago, and frankly, I'm somewhat heartened. I heard from him that he wants to move forward, that he would, he said indirectly, vote to increase the debt limit if there's a credible plan to reduce deficits in our national debt. I think that is a proposal that the vast majority of members of this body agree with. Of course, the proof's in the pudding. It's what is that credible plan? What is that mechanism? What is that assurance that we are going to reduce the budget deficits prior to vote to increase the debt limit? It's very important that that vote to increase the debt limit occur without brinksmanship. We had far too much brinksmanship in the lead up to the continuing resolution, where just a matter of $2 or $3 billion in the last 11th hour. The vote to increase the debt limit is a far, far more important vote. The stakes are much, much, much higher. The dollar amount is much greater. The financial markets will be watching it very closely. And we, members of the Congress, working with the President, must find a way to get the debt limit increased, but with assurance that we're going to get the deficits down and the debt down in a credible way, in a proper period of time, so we don't have to push up to that final moment, the final minute, before the vote on the debt limit occurs. And as I listened to my colleague from Louisiana, I sensed that he wants to find some way. I think we all do. And that is our challenge, Mr. President. That's our charge. Over the next couple of months, find that way, find that mechanism, find that process that's credible, it makes sense. Both sides can buy into it, not knowing exactly what the final result will be, but knowing that we're starting down a road to get the budget deficit under control in a balanced, fair way. I do not mean to sound critical. I don't think the Ryan budget proposal is balanced. I don't think it is fair. But I do think members of the Senate, a vast majority, do want to find a fair, balanced solution, and it's up to us to try to find that before that vote in the debt limit occurs. Mr. President, I yield the floor.